Mr. Chairman, Ranking Member Klein, and members of the committee. Thank you for the opportunity to testify about the Occupational Safety and Health Administration's State Plan program and recent investigation of the Nevada State Plan. Section 18 of the Occupational Safety and Health Act allows states to operate and enforce their own safety and health programs. Currently, 25 states and 2 territories have state plans that deliver the OSHA program to 40% of the nation's workplaces. State plan standards and enforcement must be, quote, at least as effective, unquote, as federal OSHA. In addition, the state plans operate under authority of state law, not delegated federal authority. States must also provide at least 50% of the funding for state OSHA plans. There are a number of advantages to state plans. They add resources to the federal program, which would not otherwise be available. They cover state and local government employees who are not covered by federal OSHA, and they have the flexibility to deal with workplace hazards that are sometimes not addressed by federal OSHA. For example, California recently issued standards for heat stress, airborne diseases, and popcorn lung, a disease associated with exposure to the flavoring chemical diacetyl. As valuable as the state efforts are, however, federal OSHA is required to maintain effective oversight of state plans to ensure that all workers in America are protected. Nevada's operated a state plan since 1974. A high number of well-publicized construction-related fatalities on the Las Vegas Strip in 2007 and 2008 raised a number of serious questions about the operation of Nevada's OSHA program. As a result of these fatalities and a number of complaints filed against the state plan, I commissioned a federal OSHA task force to conduct a thorough evaluation of the Nevada state plan. The review took several weeks and evaluated 23 of Nevada OSHA's fatalities that occurred between January 2008 and June 2009. Nevada OSHA fully cooperated with our investigation, providing all the records that we needed. For this study, federal OSHA identified a number of serious concerns about the Nevada plan. Even though the files examined were primarily cases involving the death of workers, only one willful citation was issued and later reduced. Willful violations are those the employer intentionally and knowingly commits, and they carry the highest penalties. Hazards identified during inspections were not addressed in citations. In almost one-half of the fatality cases reviewed, the state failed to notify families of deceased workers that it was investigating the death of a loved one. Nevada OSHA did not have procedures to assure that hazards found during inspections were abated by the employer. Inspectors were not properly trained about the hazards of construction work, despite the high level of construction activity and construction-related fatalities in the state. In 91% of the fatality cases reviewed, information from employer injury and illness logs was not obtained by inspectors. This by no means is an exhaustive list of the deficiencies we discovered. I provided the committee with a copy of the report so you can read the complete findings. I also want to take a moment to clarify that the problems we identified at Nevada OSHA were systemic problems in the management of the agency. We're not casting blame on the efforts of the dedicated staff who are devoting their lives to ensuring safe workplaces for Nevada workers. The report also includes a number of recommendations for improvement. For example, Nevada OSHA should work with counsel to train inspectors to develop legally sufficient cases, review case files more thoroughly to find hazards not initially identified, contact families of victims soon after the initiation of an inspection, ensure adequate abatement of all hazards found during complaint inspections, and provide staff with additional training on construction hazards. As a result of the deficiencies identified in Nevada OSHA's program and as a result of the administration's goal to move from reaction to prevention, I've notified the state plans that we will be implementing a number of changes to strengthen the oversight, monitoring, and evaluation of state programs. I sent interim guidance to OSHA's 10 regional administrators in August, encouraging more extensive investigation of potential problems. I also told the regional evaluators to maintain more frequent direct contact with the states they oversee and to keep abreast of state legislative developments, major incidents, and local initiatives. In addition, to ensure that similar deficiencies do not exist in any of the other state plans, federal OSHA will conduct evaluations similar to what we conducted in Nevada for every state that administers its own program. These evaluations will assist federal OSHA in improving its monitoring system and lead to better program performance and consistency throughout all state plans. We will involve states in the development of the revised monitoring procedures. OSHA is emphasizing to our state partners that we are not trying to change the nature of the relationship between federal and state OSHA, but we do need to speak with one voice and assure American workers that they will receive adequate protection regardless of the state in which they work. However, if Nevada or any other state where problems are identified fails to make the necessary improvements in a timely manner, OSHA could reassert concurrent federal jurisdiction. Beyond that, withdrawal of a state plan would be the appropriate sanction, when major and pervasive deficiencies are present and the state does not correct them. Mr. Chairman, I appreciate your work today in shining a spotlight on what has been an obvious gap in the protection of our workforce. Thank you again for this opportunity to discuss the OSHA State Plan program and our study of the Nevada State Plan. I look forward to your questions.